According to statistics of Kenya Health Facility Census Report of 2023, only 2% of the sampled facilities offered all the basic outpatient services, not to mention the vastness of some counties. For instance, in Kajiado County, health centers are few and far between, forcing desperate patients to walk unimaginable distances to access basic services like reproductive healthcare, maternal child health, just to mention but a few. With these mounting challenges, Kajiado residents would brave the sweltering temperatures in the sultry, stunted airs in pursuit of healthcare facility. Reproductive Health Network Kenya, RHNK, while on their feasibility study in Kajiado West, came across faces of disconcerted residents who could not stand seeing their hallucinating kins capitulate to their struggles.
We were able to identify this place, and quickly we thought, why not? We could set up a facility that helps this population. Because as we were coming, we were thinking of women that get pregnant, women that need to deliver. And because as we were coming again, we could not see any vehicle on the road. So we thought about that woman that is pregnant. When she needs to deliver, how does she get to a health facility?
Naserian Saidi, a mother of 6 and a resident of Torosei location in the outskirts of Kajiado County, is just one of those women who could not help but resort to the unconventional methods of reproductive healthcare services during her pregnancy periods.
Nikisaa nyumbani kwa sababu watoto wangu wote nilizaa nyumbani. Na nikigonjeka labda niangalie kama nitapata pikipiki niende hosi. Ninachukua tu masaa kama mawili hivi ama matatu. Sawa, nikienda raha na mguu. Kage na nikiingia pikipiki nalipa 600.
Saidi is a beleaguered woman. Her tribulations began just after the birth of her last born that counted after the father of her children departed and left her forlorn. In her new journey as a single parent, Mrs. Saidi took every step with a surreal memory of hindsight events. The erection of this facility in her location wouldn't have come any earlier for her.
Na niko na watoto 6 na nilikuwa ninataka upanga usasi kwa sababu mimi tu ndo nakaa na watoto wangu. Sina babake, ninakaa tu peke yangu. Ninalea watoto wangu mpaka akue na ninataka kusoma na sina kitu ya kusomea. Kwa sababu babake aliniacha nikiwa mdogo na aliacha hawa watoto wake alikuwa mdogo. Saa hii amekuwa kage sina kitu ya kusomesha.
Just like her, the birth of this facility in Torosei location was warmly welcomed by all and sundry, with thrills awash in their faces, thanks to the benevolent sponsors.
Hii facility imetusaidia sana kwa sababu wakati ile hatukuwa na facility tulikuwa tunaenda mpaka Kajiado district. Na saa ile ya mvua hatukaanza kusafiri. Sasa ilikuwa na changamoto mingi. Tumepoteza watu wengi kupitia hiyo hali ya barabara na kupitia hiyo hali hatuna madaktari. Sasa wamama wengi wameumia na watoto wameumia.
The idea of this facility was indeed a stroke of genius, owing to its proximity to the market center and the choking impacts of climate change to both lives and livelihoods would just help a great deal of relief to residents.
Opened this facility on a market day, and that day we saw about 250 something clients. And what we heard them say is that they can't believe that they have a facility where they can just walk in and get the services. But again, what we saw that time is that the health-seeking behaviors, women came to access healthcare when they were also coming to the market.
Hiyo si alitusaidia kwa sababu mama mwingine alienda kusalia hiyo si. Alafu hata si tumepata matibabu.
A paradigm shift that has melted away the basic health concerns to this generation, considering that safety and posture are the twin essentials for the indigenous community full of traditions and melodious renditions.
Piga uondoke tafadhali.
Saa hii mahali tuko tumeshasaidika sana. Saa hii ile wiki mimi hata nilijigonga na shindano hapa mkono, nikakimbizwa hapa, dakika moja tu nikatolewa hiyo shindano na nikapata matibabu. Juzi tu nilileta mama akajifungua na alikuwa na twins na alipata matibabu vizuri sana. Kwa saa hii tumesaidika sana kama Torosei location.
Torosei location is a fortress hedged from the previous anxieties of seeking basic healthcare services over 50 kilometers away, a reality that most residents give with a lot of effervescence narration.
Sasa saa hii nikitaka tena kuzaa naenda kuzalia huko Osi.
The facility is 2 months old here, and ever since we got them here, we have seen an improvement of health services. They have just come to supplement the efforts of the government in health services provision, and as a community we are very much delighted.
With this emancipation, residents of Kajiado West and its environ would only hope for setting up of ancillary centers that would augment on their health demands.
Services tumepata kwa hiyo hospitali, tumepata clinic ya wamama, tukapata clinic ya watoto, na ni clinic ambayo unatibiwa kila kitu. Unapimwa damu, unapimwa pressure, unapimwa kila kitu. Wakati ile tulikuwa tunaenda hii ya serikali, unaenda tu, unawekwa tu hivi mashini tu kidogo, unaenda. Lakini saa hii tumepata kila kitu. Matibabu yoyote yenye tunahitaji tunapata. Na saa hii kama wanaona kama ile mashini wanakupeleka tu direct. Kuna ule alipelekwa last night, wakamtibu tu na akaweka dawa akasema ipelekwe Kajiado. Saa ile si tunalia hapa tunaona afiki, akafikishwa na daktari yeye mwenyewe alituambia tu atafika. Na akafikishwa na akatibiwa na amepona. Na kama angekuwa hapa huyo tungempoteza tu.
What started as a cursory study of reproductive health patterns in the western side of Kajiado County has today turned out to have a redounding effect on the image of community-based organization. A community which was once perceived to be ingrained in traditional treatment ways is now assimilating to the conventional methods as a result of effects of the decentralization of health facilities.
For us, we set up this facility, number one, to reach out to the rural woman, because when you go to the urban centers or even the peri-urban centers, you'll get a lot of private facilities. But when you come to this particular place, the rural woman who is most vulnerable, marginalized, is not able to access these services. And more importantly, because of this community, this is a pastoralist community, and that means that their source of livelihood is feeding the animals that they have. So they keep on moving from one point to the other. So even access to healthcare is almost not a priority. So for us, this being a shopping center, and we know that they'll always bring their animals here when they need to sell them, then we know that they will never miss out on services.
This was an enthralling moment for the community, men and women alike, considering the significant reduction on downtime, perhaps one that would fit the meaning of a healthy society.
Women take the long distance, 45 kilometers to a facility by a boda, I mean, that is torturous to a pregnant woman, for example, or even just a sick person. So really the fact that we are able to bridge that gap and bring facilities very close, a facility closer to the community, for me it's very satisfying. And in a way, of course, we know we will be contributing to the reduction of the mortalities and morbidities in this community.
Men and women of Torosei location can now worry away from their previous concerns of lack of access to elementary healthcare, or better, turn their back to the feverish turn of activities in urban healthcare facilities. Under the twilight of the dying sense of the unconventional treatment methods, The birth of such facility brings with itself a ray of hope to both the government and non-state actors towards realization of universal healthcare coverage in Kenya.
Oh yeah!